Hi. Hi, you pregnant mom? You mom to be? Yes, you. It's you I'm talking about. It's you I'm calling. Yes, it's you. Yes, come here. Because we need to talk. Yes, we need to talk. We need to have a sit down. Hmm? Yes, you. Hey guys, I hope you're doing well. Welcome and welcome back to my YouTube channel and welcome to Talk to Your Midwife session. Yes, this is a Talk to Your Midwife session and we really need to talk. Moms to be, women who are still in their waiting period. Yes, you as a woman, we really need to talk. Okay? Just as the title says, these are things that every midwife would wish you as a woman or as a pregnant woman knew. And these are there's some things that really irritates the midwives. We have so many things, several things which really irritates a midwife. Okay, and that means you as a mom come to the hospital, meet the midwife, because that is the time you'll meet a midwife when you are about maybe to go and deliver your baby, or when you are about to go into labor. That is when you get to meet a midwife. And I want, now that I've been a midwife for years, I want to inform you and I want to let you know things that we always wish. Like, I sit down and I wish you as a pregnant woman could be knowing. Okay, and we have several things. I have a list of those things. Yes, I have a list of them, and we will tackle one by one by one. The greatest, number one, not the greatest of all, because all of them are great, but number one thing that irritates a nurse or a midwife is when you come to labor ward and then you try to order me, your midwife, on what to do based on your research in Google. We say Dr. Google. We have a lot of mothers who come into labor ward pretending to know a lot just because you're using the Google information. Mama, this will mess you up, and this will mess your relationship between you and your midwife. Never use Dr. Google's knowledge. It's okay that you have Googled. It's okay that you have known that when you are in strong contractions, you need, when you are in a mild contraction, this is what needs to be done. When you are in moderate contractions, this is what needs to be done. Or when your nurse does this, takes your vaginal examination, checks your vaginal dilatation or cervical dilatation, sorry, this is what needs to be done. My dear, it's okay to have that knowledge, but never use Dr. Google knowledge when it comes to you as a person. Let me explain this, and let me explain why this will happen. Okay? So, what happens when I assess you in labor? The management that I will give you, or the management protocols, or whatever I will be doing to you, will be based on my results or my findings during my assessment, during my vaginal examination, during my assessment when I'm assessing how far you have dilated, that is the cervical dilatation, and also assessment on how your contractions are, the pattern of your contractions, and also the heartbeat of your baby. So sometimes you might find that Dr. Google is telling you when you are this and this needs to be done. But from my assessment, whatever Dr. Google is using is not what I am using. So okay, it's good to have that knowledge, but don't come with that you see, there is that mindset and that attitude of, I know this is what you're supposed to do, why are you not doing this? And you find that these are things that end up raising a lot of concern, because especially when you have a spouse or you have someone around you, they will see that I am not doing what you want. So they will perceive me as a bad midwife, or as a midwife who doesn't know what she's doing, or as someone who doesn't understand you. Okay? So you'll find that will raise a lot of concerns. People will start saying, oh, why are you not doing this? Oh, you see, even we have our friend or our sister, her sister, this and this was done to her, but we are different. Me, the way I underwent my labor will be so much different from you. The way you are undergoing your labor will be so much different from your own blood sister, or even if you have a twin, you will get into labor two different ways, and you'll have two different, like you'll have two different experiences. Reason is because your body is producing hormones, its own hormones. And also that is why you find that also don't come with that knowledge of like, but you see the first and the second pregnancy, it was like this and this is what we used to do. No, each time you carry a pregnancy, new hormones get produced. So once you carried your firstborn, the hormones that were produced during that first pregnancy, they completed once you delivered that baby. When you conceive a second born, the body will still reduce, it will produce some hormones. The body might have produced enough hormones to bring you natural labor, the first pregnancy, second pregnancy, third pregnancy. But the fourth pregnancy, unfortunately, the fourth pregnancy, you find that you're getting into term, there is no labor. You're getting even in postdatism, still no labor. And then you go to the hospital, and then the doctor or the midwife tells you, we have to induce you. And then you are like, but how? I have never been induced. My labor always comes, and in fact, I take like 2 hours and deliver. Okay. So we are managing you right now based on the findings that we are seeing, the findings that we have assessed you and gotten these findings at this specific moment. So each midwife, just know that each midwife will wish that every mother comes to the labor ward and listens to the doctor and listens to the nurse or listens to the midwife, because we will do whatever it counts at that time, depending on how you will be, depending on how your baby's heartbeat, depending on so many things. So there are so many things that we consider. So that is one thing that really irritates the nurse, coming and using Dr. Google's information. So my mom, it is an advice for you. If you're there, you are in labor, you're watching this video, you are about to go into labor or you're pregnant, kindly, when it comes to that time, the information that you have gathered, when you get to the hospital, just stay with that information, okay? Unless when you realize that there's some neglect. If there's some neglect, it's okay. That is another case. You can even get to report that midwife to the higher authorities of that hospitals, or of that hospital that you'll be. But if there is no neglect, don't pretend to know so much. Because once I realize that you pretend to know, somehow I'll be like, it's okay. You want, because people are different. I myself will not leave you, but others will, because we are human beings. Others will be like, oh, that is what you want it to be done. It's okay, well and good. For my case, in case I see that you insist so much and you are not cooperating, there is something we call an informed consent. To an extent, if I see that things will not go the way it should be and we might end up messing things, I will just come with your file and with an informed consent, and you'll have to sign for me that I have advised you to do this and this, but you are refusing, so that in case anything happens, I will not be there to be blamed. So please, get this get to know this. Do not use Dr. Google. When you go there, go as a humble mom. Just be there. Yani, weka tu hapo, let the nurse attend to you. Let that midwife attend to you. Let them advise you. Even when I'm giving you health education, when I'm telling you, mama, this is how we expect, don't pretend like you know so much, because things might turn out in a bad way. Things might turn out the way we don't expect them to turn out. Okay, so that is all about that. Let's continue supporting this channel. Kindly subscribe to this channel, join this family, so that we get to educate each other, we get to create awareness, especially on issues relating to health and also reproductive health, on this forum of Talk to Your Midwife session. So thank you.